Good afternoon. I like the way everybody's starting to spread themselves out. That's fantastic. Responding to our advice, and that's really where I want to begin, by thanking everybody, by thanking you in the media, and also thanking everyone for the huge efforts that the country is making to comply with the advice that we've been given. And we're asking such a huge amount, asking students to put their education on hold. We're asking people not to socialize in the normal way. And already we can see the impact that this is having on the UK economy and on business, on great companies. And so it's vital that we in government stand behind them when what we are asking everyone to do is so crucial for saving literally thousands of lives by defeating this virus. And I'm conscious as the days have gone by that people will want to know how long we are expecting them to keep it up. And I wanted to try to say something today about how I see the timescale of this campaign and where we're going and what we need to do. And I do think, looking at it all, that we can turn the tide within the next 12 weeks. And I'm absolutely confident that we can send a coronavirus packing in this country, but only if we take the steps, we all take the steps that we have outlined. And that is vital, because that is how we're going to reduce the peak. And once we've achieved that, and I think that we will, if we do take the steps that I've said, then the scientific progress that we're making will really start to come into play. And I wanted to discuss a little bit of that this afternoon with you, because we are rapidly becoming so much better at understanding the genomics at the heart of this virus. A lot of that is going on in this country. We're getting better at understanding the medicines that may treat and cure it. And today we've put the first British corona patient into a randomized trial for drugs that may treat the disease. UK experts, scientists expect to start trials for the first vaccine within a month. And above all, we're getting better at testing. This crisis is so difficult because the enemy is invisible. And the answer is to remove the cloak of invisibility and to identify the virus and to be able to know which of us is carrying it or who has actually had it and now got over it. And to give you an idea of what is coming down the track, we're in negotiations today to buy a so-called antibody test, as simple as a pregnancy test, that can tell whether you have had the disease. And it's early days, but if it works as its proponents claim, then we will buy literally hundreds of thousands of these kits as soon as practicable, because obviously it has the potential to be a total game changer. Because once you know that you have had it, you know that you're likely to be less vulnerable, you're less likely to pass it on, and you can go back to work. And of course, by the same token, we're massively increasing the testing to see whether you have it now, and ramping up daily testing from 5,000 a day to 10,000 to 25,000, and then up to 250,000. And that knowledge of where the virus is will make a huge difference to our management of the disease and our ability to reduce disruption and economic difficulties. And I wanted to set that out because this is rapidly coming down the track, as I say, but it will take time to come on stream. And that is why, in the meantime, to get back to a theme that you know I'm going to repeat, it is absolutely vital that we follow the advice that we've been hearing over the last few days, the announcements that we've already made about staying at home if you have the symptoms, if your family has the symptoms, about avoiding unnecessary contact, avoiding gatherings where you may pick up the disease, pubs, bars, restaurants. Please follow all that advice scrupulously. Work from home if you possibly can. Wash your hands. Wash your hands. And it's by this combination of ruthless, determined, collective action and scientific progress that we're already seeing that we will succeed. And I know how difficult it may be, or it may seem right now, but if we do this together, we will save, as I say, many, many thousands of lives. And to everybody in the UK business world, everybody who is worried about their jobs, and everybody who faces difficulties because of the advice that we are giving, I say to business, stand by your employees, stand by your workers, because we will stand by you. And you'll be hearing more about that in the course of the next day or so. And that is how, by a mixture of collective, determined collective action and scientific progress, I have absolutely no doubt that we will turn the tide of this disease and beat it together. Now, I'm going to ask, I don't know whether either of our two distinguished experts need to add anything to that. I don't think they do. Why don't we just go straight to questions? I don't propose to spend a very long time at this particular one, since we've had about 4 or 5 of these already in the last few days, and I don't want to weary you with these occasions. Do you feel they're useful? Good. Okay. Well, that's positive. Let's go round to Laura first. Laura Koonsberg, BBC.
Thank you very much, Prime Minister. You told the country yesterday you wouldn't hesitate to take extra measures. People are worried about what that might mean.
Yes.
Can you tell people what might be next? Will you, within days, seek to shut pubs, cafes, clubs? And a lot of people have contacted us today to say the measures set out for businesses to apply to loans is simply not quick enough for them to be able to keep their staff on. We've had a lot of messages from people who are running businesses who are deeply worried. Is it good enough to say to business, you can apply for a loan, when many of them face immediate decisions that might mean they have to cut staff?
Yeah. Well, first of all, on decisions about pubs, bars, restaurants, and so on, as I said, we're guided very much by the science and whether we think that the advice that we've given is working. So as long as we think that people are actually staying away from places where they may transmit or pick up the disease in the way that we've recommended, that they should avoid those places, if we feel that that is working, then we just want to say thank you to everybody for their extraordinary efforts and encourage everybody to do likewise. If we feel that it isn't working, as I said yesterday, and we need to bring forward tougher measures, then of course nothing is ruled out. But I want to thank everybody for what they're doing. I know it's tough, I know it's difficult, but we've just got to do it together. And please, please, please follow the advice. Second thing, you mentioned businesses. A lot of them will, of course, get grants up front, but I'm all too aware of the difficulties and worries that they face. There'll be more on this tomorrow from Rishi, the Chancellor, Rishi Sunak, the Chancellor. And my message to business is the one I gave just now: stand by your employees, because we're going to stand by you, and we're going to stand by the workers of this country. And there's an important point I want to make. This time it's going to be different. As we come through this difficult economic phase, you remember what happened in 2008. Everybody said we bailed out the banks and we didn't look after the people who really suffered. This time we're going to make sure that we look after the people who really suffer from the economic consequences of what we're asking them to do. And we'll be directing our support to them first, looking after the people first. Beth Reeby's going.
Prime Minister, just a couple of questions. Over the half of the 29 deaths today are in London. So, PM, I have to ask you on behalf of Londoners, do you not think it is now right to move to a more substantial lockdown of the capital like they have done in Italy and Spain and France, where you can't leave your house unless you're a key worker or you're going to the shops for food or medicine? Are you not doing that yet because you don't know how to enforce it or you can't enforce it, or rather you'll do it but the time isn't quite right? And just secondly, a bit of hope there. You're suggesting to the public that if they follow the rules, that you can turn the tide on this disease. Are you telling people that by the summer, they just might, be able to go back to normal life, be able to go on their summer holidays? Thank you.
Yeah, thanks, Beth. Well, look, a crucial thing there. I want to stress that we do want to see people following the advice that we've given in the capital, which is, after, as you rightly say, the place where the disease seems to have been making the fastest progress, and it's vital that people follow that advice. And you know, there's huge evidence that they are in the takings in the retail sector, the hospitality sector, TfL in inner London down about 80%, in outer London down about 60%. But some evidence that in some parts of the capital, it's very patchy, and some areas where people aren't perhaps following it in quite the way that we need them to do. So, you know, that is why, to get back to the answer that I gave to Laura, we may have to consider going further. But I want to stress that, you know, there is no prospect of us wanting to stop public transport in London, or stop the tube, or the buses. We're not going to be telling people that under no circumstances, if they really need to go to work, can they go to work. I hope people understand that. There's been some, you know, I'm sure through no fault of the media, but there's been a bit of misunderstanding floating around about that. We're going to want people to avoid gatherings where they can transmit the disease. We're absolutely emphatic about that. And if it becomes necessary to do more to ensure that, then we certainly will do so. On your second question, which was really about the timing, I am very confident that we'll get this thing done. I'm very confident that we'll beat coronavirus. I think we can turn the tide within the next 12 weeks, but it depends on collective, resolute action. And I think the encouraging thing is that the more disciplined we can all be in doing that, the greater the chances that the scientific community will be able soon to come up, as I say, with fantastic results on testing, to say nothing of the other medical treatments. Robert.
Robert Peston, ITV. If I could ask a couple of questions to Chris Whitty. There's quite a lot of concern within the NHS about capacity running short in London hospitals. Could you tell us a bit about how you see the capacity issue in London? Secondly, as you'll also be aware, there is a lot of concern among medical staff that they're not getting the protective equipment, which is apparently in the system, it's just not in the right places. How quickly will you be able to get it to the right places? And then finally, Prime Minister, you came up with this very interesting number just now. You said 250,000 tests. What did you mean by that? Are they on course soon?
I'm going to pass that ball straight down the line to Patrick, who gave me the figure earlier on. But that's where we want to get to. I mean, we want to. Testing is, I think, crucial to our success in defeating this virus. We're making fantastic progress on testing. We had a great meeting in number 10 a couple of nights ago with people who are supplying tests of all kinds, not just the antibody tests that I mentioned, but much faster and more efficient tests to see whether you currently have the disease. And the potential of those to help us is obviously enormous. We're not there yet, but we will get there very soon. Patrick, is there anything you want to say about testing?
Yeah, Chris has obviously got ones to answer there as well.
Sorry.
But the testing, so Public Health England are currently leading the testing on this. They're ramping up to 25,000. There are proposals to get that much higher through other mechanisms for the virus itself. And then the antibody test, if that turns out to be something that can really be applied, that's one that you'd want to ramp up as well. So ideally, you'd like to get to those sorts of numbers. You'd like to be able to do it for both testing the infection itself and testing the antibody. Practically, that can be done. I mean, the testing for the virus is a pretty standard technology. It just happens to be obviously precise for this virus, but it's not a new technology you've got to invent. And if the antibody test is reliable and works, and you know, there's ifs in that sentence, but if it does, then that's a relatively easy thing to scale up.
On pressure in London, so at the moment, London from the coronavirus is under pressure, but indirectly, but that's going to go up. And that is actually the reason for doing all of the things we're trying to do. And the first thing that will get under the greatest pressure will be in the intensive care and respiratory care system. And that's the thing which, in a sense, that's the first point of real pressure on the NHS that's going to happen. And to be clear, even if everybody does all the things we hope and really, really would ask that they do, the numbers will continue to go up over the next 2 weeks because it takes a while for there to be a lag. There's a lag until things start to improve. Now, at that stage, we need to do 3 things. The first of which is obviously to try and pull the peak down, and that is the key thing that everybody can help with in terms of the social distancing. And let me be very straightforward. If the numbers are high enough, if a high enough proportion of people choose to and do go in for serious social distancing, and there's a lot of evidence a huge proportion of people are, we don't know yet whether it's enough, that will pull the peak down. If they do not, then that is going to be a problem. This is the national effort bit. The second thing we have to do, and this is an NHS issue, is to increase the number of beds which are capable of taking respiratory patients, because that's the big bottleneck for this particular infection. So that's very important. And then the third thing we have to do is, at the moment, all NHS staff who are getting symptoms that are compatible with this virus are quite rightly self-isolating and isolating with their families if they have a household, and that is taking people out of the system. And the key thing we need to do is get the testing out. First priority was ITUs, second priority all the people who got symptoms, but the next priority for us is to get the NHS workers so we can test them quickly, and then if they got it, fine, they continue, but they know they've had it once. If they have not got it, then they can come back to work, or if the reason they've stayed at home is because someone else in their family has got the symptoms, we would test them and see if they've got it. On PPE, there's a local and a global issue on this. I completely understand the points that my colleagues in the NHS are concerned about on PPE. They write to me regularly about this, and entirely reasonably, and this is a major strand of work for the Department of Health and Social Care, is to make sure that this works. Obviously, in the short term, this is about making sure that the PPE stocks that there are go to the right places. In the longer term, it's about making sure that the global system, because of course everybody wants this, and the supplies in some areas have gone down. There will be a global list we need to put together. And the final thing we need to get right on PPE is training, because if you use PPE incorrectly, it doesn't really have any advantages, and occasionally can even make things worse. So it is important we get all 3 of those sorted out.
Thanks, Chris. Mesa Hall, Daily Express.
Thank you very much, Prime Minister. Firstly, on the antibody test that you mentioned, could you say a bit more about how that's going to be rolled out? Will people be tested in their own homes? How will people be selected whether they're going to have it? And secondly, there is some evidence that some shops and online retailers have been whacking up the prices of in-demand goods. Are you concerned that there is profiteering going on in this national crisis?
Well, I'm going to ask Chris and Patrick to talk about the test kit. Though, as I understand it, it's like a pregnancy test kit. It's, I think blood is required rather than urine. But that's the basic idea. But I'll invite the experts, the scientific medical experts, to comment on the test. And Mesa, on mass buying and the price issue, I really hope that retailers will continue to be reasonable, and I certainly wouldn't want to see profiteering of any kind. As I said before in these meetings, we've got good supply chains, farm to fork. There's no reason for the shops really to be empty, and just of course everybody understands why people are buying stuff. We're all being advised to stay at home if we think we have symptoms and so on. But please be reasonable. Please be reasonable in your shopping. Be considerate and thoughtful of others as you do it.
On the antibody tests, we should be clear that although we're confident there will be antibody tests, we're not absolutely confident yet about whether the ones that are currently on the market are the right ones, and that needs to be tested out, and that's something which is an absolute priority for Public Health England. But once we have these, the key thing for, in the first case, healthcare workers, and then other workers and members of society, is we'll be able to say to someone, you've had this virus, you're not likely to get again, at least in the immediate term, and now we can be confident you can return to work, and now we can be confident you don't need to take some of the precautions that you've been taking to date. Now, there'll be a while before we've actually got this in large enough numbers, and this is more useful for a variety of reasons. Probably this is not the right environment to go into, but more useful the further on in the epidemic it is. But this will be something which helps society to normalise little by little, even whilst we still have a significant number of cases. So this is going to make, as the Prime Minister says, a very big difference in the long run once we've got tests that we can rely on.
Thanks very much. Lucy Fisher, Times.
Thank you. 2 quick questions, if I may. Firstly, to the experts. New data from the Centres for Disease Control and Prevention shows that nearly 40% of patients sick enough to be hospitalised in the US were aged 20 to 54. Is there any concern that the pandemic is affecting younger people in the UK worse than previously thought? And secondly, Prime Minister, a tide of redundancies are sweeping the country, and your own MPs have said that government is not doing enough to help struggling businesses retain workers. You've mentioned that the Chancellor is going to talk more about this tomorrow, but do you accept that every day you delay announcing new support measures will cause thousands of jobs to go?
Well, just let me say, first of all, on that, it's very, very important. Everybody understands that we will stick by businesses, and I hope that businesses will stick by their employees. This country is going to bounce back. We're going to need some fantastic companies remaining to bounce back as well. And it's absolutely vital that everybody understands that. Now, Rishi will be saying, the Chancellor will be saying more tomorrow about the package we're putting in place for workers across the country to support everybody through this difficult time. We've been talking to the trades unions and others today, and we think we'll have a great package ready to go. So I hope people will stick by their employees, because we're all going to need them.
On the second question you asked, it's clear that there are 3 things that are probably people need to think about simultaneously. Firstly, the great majority of people who get this virus, irrespective of age, will recover from it, and most of those will have a mild or moderate illness, not requiring any hospitalisation. Very important to make that point first off, because I think that is a key point for people to remember. It is particularly, it seems to be true for children, where children seemed, on the whole, to have this as a milder disease than adults, and probably quite a lot milder in most cases. The second thing is, it is also true that particular groups of older people or vulnerable people, medically vulnerable, do get this more severely. And if you look in the data from China, if you look in the data from Italy, and if you look in the data initially from the UK, most of the deaths are occurring in those groups. But, and this is the point that the US is making, and I think it's an important point to emphasise, that is not to say that there will not be severe cases amongst people who are younger adults. And that is important, because it's important that people don't trivialise this. This is a significant issue for everybody, although the great burden of disease will tend to fall in terms of severe disease in the more vulnerable groups, and that's why we've given very specific advice to people who are over 70 or have pre-existing health conditions, that there will be people who don't fall into those groups who will fall seriously ill, unfortunately. The great majority will not, but some will. And so we do ask people, take this seriously for yourself, as well as taking it seriously for all of society, and as a way of taking pressure off the NHS.
Thanks very much. Gordon Rayner. Where's Gordon? Gordon Rayner, Telegraph. Last question, I'm afraid, everybody.
Thank you, Prime Minister. Just to pick up on what Beth asked earlier, you've quoted this figure of 12 weeks to turn the tide, which is the first time you've said that. You haven't really defined for us what turning the tide means, but I don't know whether perhaps Chris or Sir Patrick might be able to explain what that would look like. Does that mean that we will be well over this and we'll be returning to our normal lives, or does that mean that we will have just hit the peak and we'll be starting to go back down the other side? What does that actually mean?
Well, what I want us to do is to get on top of it. And at the moment, the disease is proceeding in a way that does not seem yet to be responding to our interventions. And I believe that a combination of the measures that we're asking the public to take and better testing, scientific progress will enable us to get on top of it within the next 12 weeks and turn the tide. Now, I cannot stand here and tell you that we will have, by the end of June, that we will be on the downward slope. It's possible, but I simply can't say that that's for certain. Of course not. We don't know where we are. We don't know how long this thing will go on for. But what I can say is that this is going to be finite. We will turn the tide, and I can see how to do it within the next 12 weeks. Anyone want to comment on
Patrick's area?
Patrick?
Well, I mean, I think we're absolutely at the beginning of this, where the measures that are in place should start having an impact on the rate of growth of the epidemic, and those are significant measures, as we all know, and they're expected to then delay and break transmission chains. So you would expect the epidemic to come down, and the sooner we get that down, the more then we can move into phases as well, where we can test and trace and make sure that we keep on top of this. And there's a start of clinical trials, first patient enrolled today. There's the start of vaccine trials in mid-April expected. These are things which altogether start to tell us that we've moved from a phase of it's growing and we need to take these measures to try and stop it growing, to ones where we're saying put a lid on it and begin to start looking at what we do beyond that in order to get into the right position. And so I think that's where we need to get to, and that's the time scale over which we need to really push to make sure that we get there.
Thanks very much, everybody. I hope that I don't want to sound, I'm often accused of being unnecessarily boosterish about things, and I certainly don't want to strike that note today, but I genuinely think that by the combination of these two things, we will turn the tide and we will get through it. But it is vital that we all do the first of those, take the first of those two steps together. We do need a very, very energetic, concerted effort to follow the medical advice. And everybody knows what it is. We will make a huge, huge difference if we all do it together. And then I think what will happen is that we will start to see developments such as we've seen in other countries where the curve has started to come down. We will see the impact of our testing program, some of the new tests that we're talking about. I think we'll start to see those making a profound difference. And that is why my message to companies is really think very carefully before you start laying off your staff. We do want to stand behind good companies. We do want to make sure that people recognise that if they stand behind their staff, they should stand behind their staff, because we in the government are going to stand behind British firms. And as I say, you've heard a lot about that this week from the Chancellor. You're going to hear more tomorrow about what we're going to do to support employees. Thank you all very much. This is probably, I think this is I can't remember how many difference to the virus. I think that there may be a moment when we start to do this remotely. Or is that, I don't know what the plan is, but it is. I hope you agree that however we do it, it is important that we should continue to have these discussions every day. I do think that they're valuable. We try to be as candid as we possibly can about what is going on, and I hope that you find them useful. So we may have to find